Welcome back, everybody. You know what? I am here at Mercy Hospital, Catholic Health's Mercy Hospital of Buffalo, to tell you about a very important new procedure. If you have severe aortic stenosis, if your doctor has told you this and they've discussed with you that you don't qualify for open heart aortic valve replacement surgery, there's a new procedure that these heart specialists are doing that you could be a patient and benefit from. We have with us Dr. Stephen Downing, who's with us. We have Dr. Nadim Hack, and we have Dr. Joseph Gellermini. And we're going to start with Dr. Hack. Dr. Hack, this is called TAVR, and that is short for a long series of words that, again, is a procedure for people who don't qualify for the open heart correction.
That's correct. The procedure is right now approved for people who are high risk for open heart surgery or don't qualify for open heart surgery. In the future, we're hoping that it will be approved for people who are intermediate low risk.
Okay. And Dr. Gellermini, you were saying this could also be for someone who has had previous open heart surgery and may not be a candidate for that anymore.
Yes, there certainly are a number of medical conditions that put people at increased risk for having an open chest procedure, and this has been developed to help people who are at too high risk for open heart surgery.
And Dr. Downing, let's talk a little bit about this procedure because it seems very simple, but yet it gets the job done.
It is very simple, but we tell the patients it's still surgery, it's still a big procedure, but your recovery time is a lot quicker, and for particularly the older patients, you get the same results, but with much less cost on the far end, home and back to work much quicker.
So we're talking about threading up a catheter rather than making a big incision.
Exactly. A couple of catheters from the leg that go across the heart valve, and then we'll deploy the valve across your bad valve, squeezing the bad valve sort of out of the way, and then leaving the new valve in its position.
And of course, if it's less invasive, I would imagine it's easier on the patient. The patient's out of the hospital sooner and does better right away.
That's the key difference right there.
That's amazing. Dr. Hack, how long does this procedure take?
About typical case is 60 to 90 minutes.
That's amazing. That's very short considering.
An open heart surgery, right?
Yeah, that's something else. And I understand that so far we're looking at this lasting a few years for the patient.
Yeah, at least 5 years or longer.
Yeah.
That's what the data shows right now.
Wow. Dr. Gellermini, when people talk to their own cardiologist about being a patient for this, what kinds of things will their doctor tell them where they might be referred for this procedure?
They might be told they have aortic stenosis. That's a narrowing of the normal aortic valve. Normally, there's 3 leaflets to this valve. The valve can become thickened with cholesterol buildup that prevents the valve from opening properly. This impairs the normal heart function. People can have many ailments as a result of this: heart failure, heart attacks, chest pain, even dying suddenly. So when the valve becomes significantly narrowed, and that's determined by a number of tests, they should be referred on to a cardiologist or a cardiac surgeon. Or here at Mercy, we have the heart team, our TAVR team, our valve implant team, who will evaluate people and determine what is the best treatment for them, including TAVR.
It must be where you're seeing an improvement almost immediately with, fresh blood and oxygen getting around that patient's circulatory system so much faster and better.
A lot of the patients will say right away they feel a little bit better, less short of breath, a little more steady on their feet.
It's got to be exciting, gentlemen, to see something like this, be able to help that patient, which I said ordinarily they would be told you're not a candidate for any more, surgery procedures on your heart. And now we have something here that's minimally invasive and works so well where the patient can have a great outcome.
That's correct. People who previously were refused for surgery or considered too high risk now can have this option, and they do definitely feel much better. Especially a lot of patients who are in their 90s do seem to have more energy, and they always tell us that when they come to the office after the TAVR procedure, they feel better, they are less short of breath, and they are less tired or fatigued.
Once again, everyone, this is shortened down to TAVR, T-A-V-R. This is a procedure for severe aortic stenosis, folks who don't qualify for open heart aortic valve replacement surgery, and it's being done right here at Catholic Health Mercy Hospital of Buffalo.